Welcome to Concept in Medicine. It's been long. Welcome back. In today's tutorial, we are going to be looking at the menstrual cycle in cognizance of the Menstrual Hygiene Day celebrated yesterday, that is on the 28th of May 2022. Let's move ahead and look at the menstrual cycle. So when we talk about the menstrual cycle, you should know that the menstrual cycle is an orderly progression of coordinated hormonal events in a female body, not in a male body, because the male don't menstruate. In a female body, that stimulates the growth of a follicle to release an egg and prepare a site for implantation should fertilization occur. So it tells you that when you are looking at the menstrual cycle, it comes in two cycles. The first one is the growth of the follicle to release an egg. The second cycle will involve the preparation of the uterus to receive the egg should it be fertilized. So it comes in two cycles. Okay, in the definition of the menstrual cycle, we said should fertilization occur. So it means if fertilization does not occur, what then happens? That is when we are going to have the menses, or what we call menstruation, or simply what is known as period. So the question is, what is menstruation? So when we say menstruation, simply it is said to occur when the released egg remains unfertilized and subsequently the soggy decidua of the endometrium, which was primed to receive this fertilized egg, is sloughed in a flow of menses in readiness for another menstrual cycle, in order to prepare for another menstrual cycle. That is what we call menstruation, or what we call menses, or what we call period. So it means the period or the menstruation or the menses will happen if the egg released is not fertilized. All right, let's move ahead and look at the menstrual cycle, what it constitutes of. If you look at the menstrual cycle, it is divided into three phases. And what are these three phases? The three phases we are looking at primarily the follicular phase, the ovulation, and the luteal phase. So it tells you that the ovulation will take place mid-cycle. Then again, all these three phases are going to happen in the ovary. They will happen in the ovary, as we are saying. Then, if we go to the uterus, what are we going to see happening? There is going to be another two phases taking place there. And what are these phases? We have the proliferative phase, which we will talk about, and we also have the secretory phase. So it tells you that we have different phases taking place concurrently in both the ovaries and the uterus. But when it comes to menstrual cycle, primarily we are going to have three phases, which is going to be the follicular phase, the ovulation, and the luteal phase, because the phases that are taking place in the uterus is happening concurrently with the primary phases taking place in the ovary. All right, that we can demonstrate by going to this table that I've put up here. So in that case, let's look at the table. Then after that, we'll talk about the phases of the menstrual cycle. That is going to be the follicular phase, the ovulation, and finally the luteal phase. And we would comment on the phases taking place in the uterus. So if you observe this carefully, as I was saying, the cycle happens in both the ovaries and the uterus. So if it is taking place in the ovary, then we'll have the ovarian cycle. If it's taking place in the uterus, we'll have the uterine cycle. Okay, you should know that before the ovulation, there are some phases that will take place. If you take the ovaries, in the ovaries we'll have the follicular phase, which will be followed by the ovulation. Then we'll have the luteal phase. That would come after ovulation. Then if you come to the uterine cycle, in the uterus, what is going to take place? You would have the menses, that is the menstruation or the period, falling under the follicular phase, meaning it's going to be happening concurrently with the follicular phase. Then we'll also have the proliferative phase corresponding to the follicular phase taking place in the ovaries. Then finally, after ovulation, you have the secretory phase corresponding to the luteal phase of the ovarian cycle. So you can see that as one phase is taking place in the ovaries, another phase is taking place in the uterus. So this is the match. Now, let's move ahead and talk about the primary phases of the menstrual cycle. So we'll start by looking at the follicular phase. So with the name follicular, if you listen to the name follicular, follicular simply is coming from the word follicle. Okay? And if you go into the ovaries, there are several follicles. And out of these follicles, one will have to be taken and be primed to become the dominant, or what we call the lead follicle. One will have to become primed to become what we call the dominant or the lead follicle. Then the question goes, what takes place in the follicular phase? In the follicular phase, 2 to 3 days before menstruation, what will happen? The level of certain hormones. Which hormones are we looking at? We can talk about pi. Pi meaning the first P, we are looking at progesterone. The I is inhibin A. So the P we said is progesterone. The I is inhibin A. And the E is estrogen. And the estrogen here, we are talking specifically about E2. And E2, we know that is estradiol. Estradiol. There are several forms of estrogen. E1 is estrone. If you are talking about the various fraction of estrogen, we have E1. E1, we call it estrone. We have E2. E2, we call it estradiol. That's what we said over there. We also have what we call E3. That is estriol. Then we have E4. That is extetrol. Extetrol. And if you look at the various fractions of estrogen, estrone is dominant in the postmenopausal period. If you take estradiol, is the dominant fraction of estrogen in the non-pregnant woman. Then you take estriol, which is the E3. This is the dominant fraction of estrogen in pregnancy. Then extetrol, that's the E4. Extetrol, it is found in pregnancy, but in lesser amounts. If you compare the concentration of E3, that is estriol, and E4, that is extetrol, you realize that estriol is dominant in concentration as compared to extetrol. Okay, so in the menstrual cycle, what fraction of estrogen are we looking at here? We are looking at the E2. So, as we were saying, 2 to 3 days before menstruation, before your menses as a female, the level of progesterone, inhibin A, and estradiol declines. And as they decline, what will happen? There will be a positive feedback mechanism sent to the hypothalamus and the pituitary gland to release gonadotrophin releasing hormone and gonadotrophins respectively. So the gonadotrophin releasing hormone is going to come from the hypothalamus, and the gonadotrophins will come from the anterior pituitary. And what are these gonadotrophins? We are looking at the follicle stimulating hormone and the luteinizing hormone. But you should know that in the follicular phase, the hormone that is released in abundance is the FSH, that's the follicle stimulating hormone. That is why we are calling it the follicular phase. So the follicle stimulating hormone is going to be released in abundance as compared to the luteinizing hormone. What does this follicle stimulating hormone do? It stimulates the growth and maturation of a primordial follicle into the Graafian follicle, and also to be selected as the dominant or the lead follicle. Then the question goes, what then is the primordial follicle? If you are looking at the primordial follicle, just have a look at this diagram. When we say primordial follicle, simply you have a primary oocyte being surrounded by flat cells known as the granulosa cells. So if you have granulosa cells surrounding the primary oocyte, they will call that primordial follicle. And these flat cells, they are known as what? Stroma cells. We call them the granulosa cells. They surround the primary oocyte and they give rise to what we call the primordial follicle. And there are a lot of primordial follicles in the ovary, out of which one will be selected to be prime into the dominant or the lead follicle. One will be selected to become the dominant or lead follicle. The question goes, what makes a primordial follicle to be selected so as to be primed to become the dominant or lead follicle? There are two factors that are taken into consideration. Let's have a look at those factors. So these two factors, we are looking at one, the high antral concentration of aromatase in the granulosa cells. These granulosa cells, the one that I've demonstrated here. If the granulosa cells are having the highest of concentration of aromatase in their antrum, then the second one is high concentration of follicle stimulating hormone receptors. So the primordial follicle having the greatest of aromatase, that is an enzyme, and the greatest of FSH receptors is the one that is going to be selected to be primed to become the dominant or lead follicle. Once this primordial follicle is selected to be primed to become the dominant or lead follicle, it undergoes that maturation, transforming from a primordial follicle, going to a primary follicle, going further to a secondary follicle, then maturing into a Graafian follicle. Then this Graafian follicle is what we are going to be looking at with regards to the ovulation. But what will happen before the ovulation in the follicular phase? The follicle stimulating hormone, which is released from the anterior pituitary, will react with these FSH receptors on the granulosa cells. And the moment the follicle stimulating hormone reacts with the FSH receptors, it would activate the enzyme aromatase, which is also contained in the granulosa cells. And you should know, the granulosa cells produce estrogen. And how do they do that? They contain aromatase. And once FSH, which is the follicle stimulating hormone, reacts with FSH receptors on the granulosa cells, it activates the enzyme aromatase, which causes the aromatization of androgens into estrogen. So when we say aromatization, simply means you are converting androgens into estrogen. And the estrogen we are talking about here is E2, that is estradiol. We are looking at estradiol. That is the most dominant estrogen when it comes to the menstrual cycle. So once the FSH binds to the FSH receptors on the granulosa cells, stimulates the activation of the enzyme aromatase, which then converts androgens into estrogen. That is what we call the process of aromatization. What then would happen to the levels of estrogen? That's estradiol, E2. The E2 levels then would what? Rise, because they are being produced in excess. And as they rise and rise, they get to a point where they peak. They reach the highest level. And when they reach the highest level, what is going to happen? Estrogen, that is estradiol E2 in the menstrual cycle has a particular unique feature. Once its levels have reached the peak, it causes two kind of feedback mechanism. So what does it do? If you take FSH and LH, that is the luteinizing hormone, estrogen levels, that's estradiol levels going high, will inhibit the release of FSH from the anterior pituitary gland. It should stimulate the release of luteinizing hormone from the anterior pituitary. So in effect, once the estrogen level peaks in the follicular phase, it inhibits the release of follicle stimulating hormone and induces or stimulates the release of luteinizing hormone. And what will happen? The levels of FSH drops and luteinizing hormone will start increasing. And the moment the estrogen peaks, what does it do? It will also stimulate the release of proteinuses such as collagenase. And what does collagenase do? Collagenase will stimulate the degradation of the collagenous proteinaceous walls of the dominant or the leaf follicle, causing it to rupture, releasing the egg. Then the moment the egg is being released, then we'll call that phase the ovulation phase. That's what we call the ovulation, which separates the two phases, that's the follicular and the luteal. So the moment the egg is released, we'll call that ovulation. And during that period, as a female, you may experience some form of pain, and that pain, we call it the ovulation pain, or simply in medicine we call it metal schmet. So you will notice that when you are ovulating, you may experience some mild to moderate form of pain associated with the release of the egg. That's the ovulation. We call it metal schmet or ovulation pain. Okay, once the egg has been released, it signifies the end of the ovulation. Then what will happen next? Luteinizing hormone levels will start increasing, and automatically estrogen levels will start declining. And as the luteinizing hormones start increasing, it signifies the start of the luteal phase. And what is going to happen? The granulosa cells and the thicker cells will become luteinized, meaning that they would be working under the influence of luteinizing hormone before the eggs are even released. And when that happens, the thicker cells and the granulosa cells will now be referred to as the granulosa lutein cells and the thicker lutein cells. So we are going to have the thicker lutein cells and the granulosa lutein cells. And what are they going to be producing? They will be producing progesterone. Both of them will be producing progesterone. Both will be producing progesterone before the egg is even released. And once the egg is released, as I said, it signifies the end of the ovulation and the start of the luteal phase. What will happen next is that the remnant of the ruptured dominant follicle is then converted into a yellow body we call the corpus luteum. Corpus luteum. And why is it called corpus luteum? Because it contains lutein cells. It contains lutein cells having high concentration of fat. And these corpus luteum, its purpose is to produce hormones. Which hormones? It is going to be producing progesterone and estradiol. Progesterone and estrogen. And progesterone levels are going to be higher in this case, such that by the mid of the luteal phase, you would have the progesterone level peaking. That is why when you are not having your menses as regular, you are asked to do day 21 to 23 progesterone levels. Why? Because the progesterone levels are supposed to peak by the day 21 to day 23 of the menstrual cycle. That will be the mid luteal phase. So the corpus luteum will continue to produce progesterone and estrogen in preparation to receive a fertilized ovum, that's a fertilized egg. Then the question is, what happens if the egg does not get fertilized? The corpus luteum will start undergoing disintegration by what we call central hemorrhage, and that will take place by the 14th day after the fertilization has not taken place. When the egg has been released and there is no fertilization, 14 days after the egg has been released, the corpus luteum will start undergoing disintegration by central hemorrhage. But what will happen if there is fertilization of the released egg? Then the corpus luteum would continue to produce progesterone and estrogen so as to maintain the pregnancy. Until when? Until 5 to 9 weeks. It will do that for 5 to 9 weeks of gestation and eventually undergoes dissolution by central hemorrhage by the 14th week of gestation. Interesting, right? Definitely. Okay, now before we get to the menstruation, let me comment on what takes place in the uterus. In the uterine cycle, before the levels of the progesterone, inhibin A and estradiol start declining, by then there is flow of menstrual blood, there's flow of what? Blood. There's flow of blood. That's what we call the menses taking place. So towards the end of the menses, what will happen is that estrogen levels will start building up, which we describe in the follicular phase. Which estrogen? Estradiol, that's E2. And this estradiol will start causing the uterine endometrium to undergo hypertrophy. And why is it doing that? So as to get the uterine lining, that's the endometrium, thickened. Because during menstruation, the endometrial lining is very thin. The endometrium is thin, so it's able to break and shed in a flow of menses. After the menses, what happens? The uterus will need to undergo regeneration, and undergoing that regeneration, you will need estrogen, that's estradiol, E2. And in the follicular phase, E2 levels will start rising once FSH binds to the FSH receptors. So the moment the uterine endometrium starts becoming thickened, that's hypertrophy, then we call that proliferation. That is why we call that the proliferative phase under the follicular phase, because without the estrogen levels, that's the E2 going high in the follicular phase, you don't expect the uterine endometrium to start growing thick. That is why we call that the proliferative. Then after ovulation, what will take place? After ovulation, as the corpus luteum is producing progesterone and estrogen in high amounts, especially the progesterone, what is the uterus also going to be doing? The uterine endometrial cells will start releasing certain chemicals. We call them the prostaglandins. Which prostaglandins are we talking about here? We are looking at prostaglandin F2 alpha, and we also have prostaglandin E2. These two prostaglandins, they have different functions. If you take prostaglandin F2, it will cause what we call vasoconstriction. But if you take prostaglandin E2, it will cause vasodilation. So it's going to be depending on which one is greater and which one is lesser. If you take a scenario where the release ovum is not fertilized, what is going to happen? You have the levels of prostaglandin F2 alpha going high than prostaglandin E2, and that will cause vasoconstriction, and that would limit the blood flow to the endometrium, and the endometrium will start undergoing disintegration, and that is where the sloughing of the endometrium is going to take place, and it will cause the blood vessels to also what? Break together with the endometrial lining, and they will be shed in a flow of menses, and that is what we call the menstruation or menses, or simply period. What if the egg is fertilized? If the egg is fertilized, then you are going to have prostaglandin E2 being produced in abundance, and that will cause vasodilation to enable adequate blood flow to the endometrial lining so as to receive the fertilized egg in a process we call implantation. So in short, once the egg is not fertilized, the endometrium will be shared in a flow of menses in what we call menstruation. That's what we call menstruation. Now, the next question is, what is the duration of the various phases of the menstrual cycle? Okay, let's have a look at the duration of the various phases of the menstrual cycle. I mean the main ones. If you look at the follicular phase, averagely it ranges from 14 to 21 days. And take note that it is the follicular phase that contributes to the variation in the length of the menstrual cycle in females. So you will not get any two females having the same duration of the menstrual cycle, or you will not have a female having the same duration of a menstrual cycle in subsequent men. It's contributed to by the follicular phase, because the follicular phase varies 14 to 21 days. In some people, it may range from 10 to 22 days. If you take the ovulation phase, it takes about 24 to 36 hours. That is a day or a day and a half. Then luteal phase, it is fixed. Usually you have it being 14 days and does not change. Averagely 14 days. Sometimes it can vary between 13 to 15 days. And if you find the average of 13 and 15, you have 14 days. Then the question is, what is the length of the menstrual cycle? That is going to be dependent on who you are looking at. The WHO defines adolescent as individuals aged from 10 to 19 years, and define the youth as individuals aged from 15 to 24 years, and define young people as individuals aged from 10 to 24 years. So if you take an adult female that is above 24 years, the length of the menstrual cycle varies from 21 to 35 days. That is normal. But if you take an adolescent female that is aged from 10 to 19 years, you may have the menstrual cycle varying from 20 to 45 days, and that is normal. The question is, what if your menstrual cycle is lasting for a duration greater than 35 days? We refer to that as oligomenorrhea. And oligomenorrhea, basically, you are having less than 4 to 9 menses in a year. That is oligomenorrhea. What if you are not seeing your menses at all for a particular duration? Then we'll call that amenorrhea. The moment you are not seeing your menses, then that becomes absent menses. We call that amenorrhea. Then the last thing I want us to talk about before we draw the curtain is, what are the constituents of the menstrual blood? What are the constituents? The last thing I want us to talk about is, what are the constituents of the menstrual blood? What comes out? What are the constituents? For the component of the menstrual blood, the first one is going to be the shared endometrium, because that is what we said with the definition of the menstrual cycle and even menstruation. We are talking about menstruation, we made mention of what? The endometrium being shed. The next one is going to be altered dark blood. That is when you are menstruating, you will see the blood being dark. It may even come in the form of clot in certain circumstances, because once you are having blood coming out, you may have clotting factors getting in there, causing the blood to clot. The next one, you have vaginal epithelial cells. As the blood is flowing through the cervix down through the vagina, it may go along with what? Weaken the vaginal epithelial cells. So you may have vaginal epithelial cells in this menstrual blood. Then the next one is the prostaglandins. I told you the endometrial cells secrete prostaglandin. That is why we have the secretory phase. And what does this prostaglandins do? I told you there are two types: prostaglandin F2 alpha and prostaglandin E2. Prostaglandin E2 causes vasodilation. Prostaglandin F2 alpha causes vasoconstriction. And you should know that these prostaglandins, they also have an effect on the uterine musculature. What do? They cause the uterus to contract. They cause the womb or the uterus to contract. That is why during menstruation, you'll be having what we call menstrual cramps. It's because of the prostaglandins. That is why during menstruation, if you are taking NSAIDs or paracetamol, where they can inhibit the cyclooxygenase pathway responsible for the production of prostaglandins, then definitely you are going to inhibit the release of prostaglandin or the production of prostaglandins. That will cause the uterine musculature to contract. And if the uterine musculature, that's the myometrium, is not contracting adequately or it's not contracting rampantly, then definitely you will not have the pains as much as before, meaning that your menstrual cramps will be reduced. So the prostaglandins are what contribute to the menstrual cramps that you normally experience during the menstrual period. So that prostaglandin will be found in the menstrual blood. And finally, you have mucus. You have mucus also being in the menstrual blood. The take-home message is that know that menstruation is not the same as the menstrual cycle. Menstruation or menses or the period is that period where you are having bleeding, vaginal bleeding. You're having bleeding during your menses. That's where you have the bleeding taking place. That's the menses that we are talking about. But the menstrual cycle includes the menstruation, as we said. It includes the proliferative and the ovulation and secretory phase. If you take the menses, proliferative and secretory phase, they will be taking place in the uterus. But if you take the ovarian, you have the follicular phase, the ovulation and the luteal phase. So menses is just the beginning of the menstrual cycle. And what is the menstrual cycle in layman term? It is the first day that you start bleeding to the next bleeding time, meaning the first day you start bleeding in one menses to the first day of the following menses. That is what we call the menstrual cycle. From the first day of one menses to the first day of the following menses, that will constitute the menstrual cycle. But your menses is just that period of your bleeding. That's what we call menstruation or menses or period. It is different from the menstrual cycle. The menses is just the beginning of the menstrual cycle. All right, I believe we've learned something new today, and this is interesting as well. This topic, the menstrual cycle, is done in cognizance of the Menstrual Hygiene Day celebrated yesterday, 28th of May 2022. And I believe you've learned a lot of stuff. Kindly make sure to subscribe to my channel, like, share, and also recommend concepts you would like to see on my channel. My name is Dr. Del, and once again, this is Concept in Medicine. Bye-bye.